This is a brief overview in the changes of assessment of your ongoing achievement record for Year 3. So we made some changes to your assessment processes, and hopefully it's going to make it a lot more easier for you and your mentors, and our trials certainly have proven that. So, an overview. We're going to be assessing the domains rather than the component parts of competencies that you're used to. Each domain will require 3 forms of evidence, which reduces this substantially. There'll be 12 forms of evidence for each placement. We're moving from a grading of 1 to 6 to percentages, which gives your mentors more freedom to make judgments about where they want to place you on the 0 to 100% continuum. And PebblePad will change, and we'll have sections for you to store for each domain. So let's have a closer look. So as I said, we're assessing the 4 domains of the NMC standards for competence pre-nursing education. The 4 are professional values, communication and interpersonal skills, nursing practice and decision making, leadership, management and team working. All domains will be assessed in each placement. So a minimum of 3 forms of evidence are required for each domain. 1 must be direct observation, which you're used to, and 1 must be reflection, referenced and is to be related to a 3rd form of evidence. So here's the evidence that you're used to, but we've added wider patient engagement and activity and service user reports to the evidence. So direct observation in the domain area and reflection on 1 other form of evidence. A total of 12 pieces of evidence for each domain. So mentors will indicate to you the level of achievement they think you have for each domain. They're expected to judge you pertinent to the stage of your program. For you, it's a Year 3 student, so that's preparing you right up to registered practice, and the grades will identified, so we'll have a look at those in a second. As always, you need 40% to achieve a pass. If you're referred for any domain, then you set up an action plan which between you and the mentor to take into the next placement. If you are in your final placement, then you're going to be required to undertake further placement time following the award board, and domains will be capped at 40%, and as normal 2 assessments as summative for practice. So let's have a look at the grading grid. Here we have a level of performance, and it's about expectations. Your mentors are going to grade you using the grades indicated, so if you're going to get a satisfactory pass, you might get just or middle or at the top end, and that runs right across the scale. Some guidance for the grading is here. The practice, this needs to be safe, and it needs to be evidence-based, which you will do through your evidence that you provide for the assessment. Let's have a look at domain 1, which is professional values. So this is indicative guidance for your mentors to make judgments about you. This is going to be expected of you in all domains, and so ideally you would improve your scoring from one domain to the next, because you're going to build your knowledge base, build your understanding and build your performance level. None of these are unfamiliar. These are the competencies that the NMC dictate for this domain. So let's look at communication. Again, here are the competencies expected from you in this area. Nursing practice and decision making, and again it's about assessment, medication, recognising patients deteriorating, working in partnership, and here you notice down at the bottom here If it's relevant to the placement area, you can demonstrate monitoring patients with IV fluids and hydration. And again, if we can't do that in clinical practice, then it'll be done at the university. And this hasn't changed. Again, leadership, management and team working. Here we are now at year 3. You are going to be able to work with independence, but be able to work effectively across professions and also work in partnership with service users and other healthcare professions to manage risk, promote health, well-being. As you do now, your formative assessment, you will undertake a self-assessment on a score from 1 to 100 for each of the domain, and your mentor will give you an assessment which you will discuss at formative. This is no different from what you do now. It's just a change from 1 to 6 to 0 to 100. Your summative assessment, each domain, your mentor indicates the evidence, the form of evidence they've seen, and allocate an overall grade. Those grades are added and divided by 4 and calculated by your personal tutor at the end to give you an overall percentage. Here you go, here. Personal tutor does a final summary, and for you, when this gets to your second placement, it's all about ready for registrant practice and confirmation to the NMC. If you don't achieve a domain, then a plan will be drawn up. If you're taken into your next placement, I've already indicated that you can take your you can be reassessed in the next placement. But if you're referred in more than one domain, then again they'll be considering where you need to be and whether you need to have fitness practice, but that's very rare. Where can you get more information from? Well, your personal tutor, your program lead, the copy of the OARS will be on PebblePad for you to access, and also program administration have that information. You will be having a session preparing you for year 3 practice, where the tutor delivering the session will go into things in a little more detail. And I wish you all the best and best of luck with year 3. My name is Adele Kane. I'm the Associate Head of School for Placement Learning.